Hello and welcome to The Answered Patient. I'm Jane Hansen. In this episode, we'll discuss attention deficit hyperactivity disorder, commonly known as ADHD. We'll tell you about the symptoms, how it's diagnosed, and what treatment options are currently available. We'll also provide you with some guidelines to help you get the information you'll need if you or your child has been diagnosed with ADHD. ADHD is a common behavioral disorder that develops in early childhood and is often first spotted in a classroom setting.
Between 5 and 10% of school-age children have ADHD. So if you think about it, in a classroom of 30 kids, you're going to have a couple in every classroom who need to be treated.
While ADHD occurs in both boys and girls, boys are 2 to 3 times more likely to develop it. In recent years, reported cases of ADHD have been steadily rising. In the United States, it's estimated that 2 million children have ADHD. That high number has led some to suggest that the disorder is overdiagnosed, a notion that ADHD experts dismiss.
There's been serious research done on this question. What we're still seeing is underdiagnosis and undertreatment. People say, oh, there's so much Ritalin. Well, that's because it's a very common disorder.
While the exact causes of ADHD are still largely unknown, experts believe that heredity plays a key role.
It's strongly genetic, but can also be influenced by insults to the brain, difficult birth, low birth weight, lead poisoning, that kind of thing.
Some research suggests that children whose mothers smoke and drink alcohol during pregnancy have a higher risk of developing ADHD. Environmental factors, such as a chaotic or disorganized home or school life, can also contribute to a child's symptoms. Though ADHD occurs most commonly among children, the symptoms can continue into adulthood.
If you start with 100 7-year-olds with ADHD, about 60% are going to have it as teenagers and about 50% are going to have it as adults. So in general, the symptoms tend to decline with age, but for many, they persist.
Medical experts define ADHD by 3 key symptoms: inattention, impulsivity, and hyperactivity. Children with inattentive symptoms may daydream or be unable to recall and follow simple instructions. Since this type of behavior is not disruptive, children who exhibit it are less likely to be identified as having ADHD. Children with impulsive symptoms may blurt out inappropriate comments or be unable to contain their emotions. And children with hyperactive symptoms may be unable to sit still for more than a few minutes at a time. They may also fidget or become disruptive in a classroom setting. At one time or another, these types of behaviors are probably familiar to anyone with a small child. ADHD, however, is a specific diagnosis that is given only when several of these behaviors are observed, when they begin before the age of 7, and when they last for a period of at least 6 months.
A good way to think about it is the terrible twos continued. Because people with ADHD, they display the symptoms that you see in a very young child in terms of the overactivity and the distractibility.
These behaviors have a significant negative impact on an ADHD child's home and school life. And because some symptoms can intensify in a classroom setting, teachers are often the first to recognize children with ADHD.
They are poor in social settings, they're poor in class, they're poor in grades. Many times, teachers will see the children with ADHD as being bad behavior problems because they can't control their impulses.
Something else to keep in mind is that children diagnosed with ADHD often have an associated learning disability, such as trouble with reading, basic math, or spelling. Children with ADHD may also experience symptoms of depression or anxiety. When making a diagnosis, medical professionals will conduct a full behavioral assessment of a child's school and home life. An MRI or another type of brain scan may also be given to rule out any other condition that could be causing the symptoms. While ADHD can be a difficult condition to live with, there are a number of treatments experts have developed over the years to help parents and their children cope.
Great. How's your medication doing?
Counseling is usually the first step, This includes training patients to develop problem-solving techniques and teaching them skills they can use to help focus their attention and energy. There are also a number of drugs on the market that have been used for decades to help control the symptoms of ADHD. While not all children require medication, many do benefit from a carefully tailored drug regimen. Despite its common rate of occurrence among children in the U.S., ADHD remains a relatively misunderstood illness in the eyes of the public. But it is important to know that help is available. In the other chapters of this episode, you can learn more about how ADHD is diagnosed, get some science on how it works in your body, and discover some of the treatment options currently available, including drugs and counseling. And in our personal stories chapter, you'll meet real patients and families who are living with ADHD every day. Finally, if you would like to be kept up to date on ADHD, you can subscribe to this series on healthanswerstv.com.